Healthcare in America can be expensive. In July, a Kaiser poll found 62% of Americans are very or somewhat worried about being able to even afford healthcare services.
The journalists at NBC have been investigating this issue as part of their Cost of Denial series. Last night, they talked about upcoding, when a patient sees a lower-level medical provider but gets billed like they saw a top-level specialist.
The internal medical team's note says that this patient had delivery provided by a certified nurse midwife.
But the patient was billed as if she had been seen by a doctor. That's more expensive. NBC News reviewed 27 cases provided by Consker. All 27 show similar discrepancies, suggesting there's been upcoding.
These issues are concerning for consumer advocates who say upcoding and overbilling make medical care more expensive for all of us.
That's right. Our medical expert, Dr. Payal Kohli, here to talk all about the issues this afternoon. I'm so glad we're talking about this.
Me too, Lee.
It's happened, I feel like, to every single one of us. You don't know what to do. You don't want to have to, your bill end up in collections, even if you are in the process of proving that you've already had to pay it.
Yeah.
So most of us don't really even know about billing. Talk to us about how a bill is even generated.
I mean, it's so non-transparent, right? You walk into Starbucks, you get a cup of coffee, you know exactly what you're going to pay for it. But you walk into a doctor's office, you have no idea what they're going to charge. And I'll be honest, the doctors don't either, because every plan is different, every insurance company is different. So essentially, when you come in, something is generated called a claim slip. And on that, what I do after I see you is I put a code for what I did, whether it was an exam, an EKG, an echocardiogram, an ultrasound, whatever procedure I did. Then I put a diagnosis code. Why did I do it? So what did I do and why did I do it? I also put on there how much time I spent with you and how complex your medical care is. So all of that kind of goes into a search engine. And then every insurance company has a different contract. So the same care given at a hospital could be reimbursed 10 times as high as that care given in an office visit, because the hospital says they have facility fees and it's more expensive to run a hospital. And then out comes the reimbursement to the system, and out of that, your portion, if you have a high deductible, then you end up paying that.
And then, mistakes happen all the time. I remember just earlier this year, I got a colonoscopy and ended up having to pay like $2,000 out of pocket. And I'm like,
what?
I know, no, it's true. I was like, I know this is wrong. I know this is wrong. I still paid. Ended up getting over half that money reimbursed because they were like, oh, we made a mistake. But at the end of the day, I mean, a lot of people can't afford that, even if it was like 2 months' time of being out of that money. What should patients be doing?
So patients should be actively knowing what the codes reimburse. And so this is a hard thing because, again, there's so much lack of transparency that even me as a provider couldn't tell you, you and Sam could have different bills for the exact same service. But what the problem is, and what really I think this story identified, is that there's pressure on doctors from health systems to increase productivity, increase revenues. And so they upcode. And this is the problem.
That's what it's called, upcoding.
Upcoding. It's a fraudulent medical act where maybe a midwife delivered the baby, but they say that a doctor did. Or maybe I spent 15 minutes, but I say I spent 40. No one else is there besides me. There are even search engines and AI engines that go through claims that doctors submit at hospital visits and upcode. So clearly this is illegal.
Isn't that a crime?
Yeah.
I'm like, that sounds criminal.
Where's the oversight? Is there oversight?
But it's all dependent on what I put in the record. So because of this pressure on the medical system and physicians to do this, create more revenues, because their salaries are tied to these revenues, they write in there, oh, I spent this much time, I did this. Now, obviously, some of it is innocent, some of it is not so innocent. But to your point, Alex, you as a patient need to call the number in the back of your insurance card and say, these were the codes that were dropped. What are they? And how much of it is covered? And are they appropriate? Because it's possible they could have put the wrong code on the wrong patient slip.
Okay, so that part, you can actually do something about it. You can call, you can find out what the codes mean, and that's where you're going to have some sort of leverage if something is wrong.
Yeah.
Do you guys get educated in school on how to create billing for customers or your clients, patients? Yes, sorry.
No, not at all. So the goal of medical school, the mission statement of every medical school in the United States, is to teach you how to diagnose and treat disease, not how to make money for the healthcare system. The problem is, at the end of the day, everybody cares about dollars, including the hospitals. And so doctors end up fumbling around and learning on the job. So I will be honest, despite having finished training 10 years ago, I don't know that much about billing. I run my own practice and I don't know much about billing. So you rely on other people's knowledge, oftentimes billers who are, again, incentivized to increase the charges to really what you're going to be putting into the documentation of the medical record system.
Well, how does this affect small independent practices, right, that are kind of looking for other ways? Like, it's different than a big organization who's backed by, you know, one of those larger companies.
It is. I mean, as a small independent practice, you don't get as much money back. So your margins are tighter, you're getting squeezed more, so you're more pressured to do it. On the other hand, the larger organizations have systems in place, billers and AI engines, that also encourage people to upcode. So what a lot of small practices are doing, and this is where healthcare is going, and it really, really makes me sick, is private equity, where you get a capital infusion of money from retirement accounts, from angel investors. They come and they buy a whole bunch of small practices, consolidate them into a big, large conglomerate, almost like a health system, and then resell them. So what that does is it obviously helps you make more money as a small little practice, because then you have economies of scale. You have someone helping with overhead and stuff, but it takes away from the focus on the patient, and it puts the spotlight on the billing and on collecting money. So I'm afraid what NBC highlighted is happening all over the country. It's up to us as patients and community members to know about medical billing. I'm trying to learn about it as a physician so I can protect my patients.
And you gave us a lot to take with us now. We know to call on the back of the card and ask for those codes. That's what I'm going to do. So Dr. Coley, thank you.